Chapter 29, The Child with Musculoskeletal or Articulation Dysfunction, Part 1. So immobility is really a bad thing. One thing that happens is muscle wasting. You get decrease of muscle size, strength, and endurance. That muscle wasting is going to change metabolism. It's also going to throw off the nitrogen balance in the body. You get bone demineralization. You need to be upright, putting weight and pressure, stress on your bones for you to put calcium into your bones. And so if you're not putting that weight and that stress on the bones, calcium is going to leach out of the bones into the bloodstream. So we're actually going to see high calcium in the serum of the blood because it's come out of the bones. So now we've got weakened bones. So fractures are more likely, more of an issue. Contractures. If you don't use tendons and ligaments, they shrink. And once we've let them shrink to the point that we have contractures, you usually can't do anything other than surgery to release those contractures. So we really want to be doing range of motion, keeping that joint mobility, preventing those tendons and those ligaments from contracting. Circulatory stasis. The blood is not going to circulate as well if we don't have muscles squeezing the veins, causing venous return. So blood is going to sit there. Old blood or old platelets get sticky. Hypercoagulability. So we're at a higher risk for having coagulation start where it shouldn't in those deep veins. So we're at risk for deep vein thrombosis. Along with that circulatory stasis goes edema, because you're not squeezing the lymph vessels to return the lymphatic fluids and get those back into the bloodstream. And so edema is also part of that. So here's a graph from an older book that shows some of these things we just said. This muscular system, the atrophy, weakened muscles, the bone demineralization with that calcium issue, changes in metabolism which affect nitrogen balance, changes in the cardiovascular system, along with the deep vein thrombosis. We also see this change in ability to constrict vessels, and we're going to see more of an issue with orthostatic hypotension. And then we said that's venous stasis and edema. We didn't really say, but it's also going to affect our respiratory system. You're not going to breathe as deeply because you're not upright, right? You're laying flat. You don't have gravity working for you as the diaphragm moves. So you're going to have more shallow breaths, which make you prone to developing pneumonia or atelectasis. The weakened muscles also mean you're not going to breathe as effectively nor cough as effectively. So again, atelectasis and pneumonia. The GI system, if you're not moving, you're going to have decreased motility, which is going to make you at risk for constipation, which is going to affect your appetite. If you're not upright, you're going to have urinary stasis. It's hard to pee laying down. You don't have gravity working for you. And then integumentary system, risk of skin breakdown. Right? You're laying on skin, compressing all those little vessels so you don't have as good of circulation to it. And over time, it breaks down. So we want to be sure we're turning them, whoever we've got immobile, making sure that we've got frequent position changes at least every 2 hours. So those are true for adults and kids. Some of the things we want to think about specifically with kids are when we have an immobilized child, they now have change in their environment and how they're going to interact with their environment. The decreased environmental stimuli. They're not getting all of that stimulation that a child is used to, whether it's they're not getting the sensations of the touch or the ability to pick up and bite and throw, but it makes it a lot harder to meet their developmental milestones. There's going to be a perceptual difference that they're going to develop about themselves and their environment and their ability to interact with their environment, because they don't have the ability to do some of the things that other kids do. And it's harder for them to meet those developmental milestones. This can lead to feelings of frustration, helplessness, anxiety for them. They're frightened of doing the things they see other kids doing, even though they want to, which can lead to depression, anger, or maybe aggressive behavior. And a child we've imposed some immobility on them, maybe a medical procedure or a fracture or something has happened, we may see that aggressive behavior, but we also may see regression. So a child who was potty trained may start having accidents, or they may just start acting younger, more immature, even though they were acting more mature previously. And that is common and not really something to be concerned about. We need to tell parents that's typical, that's normal. It's not something we need to worry about. And how is this going to affect the family? So if a child's immobilized for a long time, they don't just fit normally in a car if they're in, a big cast, or they may not even be able to get out of bed and out of the house at all. We're going to try and get them home if we can, but if they're in the hospital, then we've got all those issues of the family trying to keep normal family life for the rest of the family, but a child in the hospital. Or, if the child can't fit into a car seat, how do they get to the store and the bank and those things that they need to go and do? So we may need to get them some help at home, get them some respite care. So we have someone taking care of this child who knows how to take care of them medically, so the parents can go do their grocery shopping and run the errands, or just take the other kids to and from school, whatever, do the normal life activities that they need to do. This may push some of our families beyond their ability to cope, or right up to their limit of coping skills. So getting them some counseling may be very helpful, or getting them in support groups where there's other people around who can understand the frustration they're going through. So nursing care of a child who's immobile. Well, pressure reduction, special mattresses or the gel pads if they're in a wheelchair, those sorts of things. Frequent repositioning, right? At least every 2 hours. SCDs to prevent those deep vein thrombosis, improve venous return, prevent the edema by increasing the return of the lymphatic system, and or anticoagulant therapy like Lovenox shots. They're probably going to be on a high-calorie, high-protein diet, and this is about maintaining that nitrogen balance. It's going to help with that, having the high protein. And then encouraging as much movement as they are allowed, but we need to know what their medical limits are so we don't go beyond them. Okay, so moving on to soft tissue injuries. So that means muscles, ligaments, tendons, those areas, soft tissues. So let's first define things. A contusion just means bruising, or our medical term is ecchymosis, right? This is small broken blood vessels in the soft tissue, usually in the muscle. And this is the black and blue spots. We've all banged something, right, and gotten a black and blue mark. So that's a contusion. Dislocation, this is when the bones get pulled out of alignment. Ligaments hold bones in place, and somehow the ligaments get stretched or tugged, and those bones get out of alignment. A common thing that happens in children, they call it nursemaid's elbow. It's subluxation, which means a partial dislocation of the radial head, which this usually happens, a parent's holding a child's hand, and either the the parent yanks because the child's not coming when they're being told to, or the child throws himself down, kind of pulling themselves away, but it pulls that elbow out of alignment, and the child screams and it's painful, and then they won't move their elbow. It's actually very easy to put back in. You go to the doctor and they turn the hand supine, and then press on, I guess, the radius, I don't know. Anyway, hold the bones in the elbow there and flex it real fast, and it pops right back into place. It hurts when it happens, but then the kid's just fine afterwards. This typically happens on kids younger than 5. Actually, one of my boys, we had this happen 4 times between about ages 2 and 4. And they just have looser joints. Different things every time. One time he was on my husband's shoulders and kind of threw himself back, and my husband's, of course, holding his hands and trying to prevent him from falling backwards, and then he starts screaming and his elbow's out of joint. Holding by the hands and swinging around in circles, which that happened one time as well. So anyway, it's a very common injury that happens. It's very easy for the pediatrician to put back in. But it should be done quickly. The longer it's left out, the more swelling and difficulty than putting it back in. Okay, so that's dislocations. Sprains, this is also those ligaments in a joint. They're either very stretched or get little micro tears in them. Often you can have a damage to the other surrounding tissues. Someone will say it feels loose. It does not feel supported. Your knee or your ankle. We've probably all twisted our ankle, sprained our ankle. It usually happens fast, right? You turn your ankle wrong, and then it can swell, it can hurt, and it just doesn't feel stable. A strain is different from a sprain in that it usually happens very slowly. You still have these microscopic tears to the muscles and the tendons. You still get pain, swelling, but it usually happens slowly. It's usually more of the same motion over time, pulling on the same things causes that strain. What we want to do with all of these soft tissue issues is treat with ice for particularly the first 24 to 48 hours. We want to prevent or bring down swelling by using ice. You don't put ice on for more than 30 minutes. In fact, the recommendation is usually 20 minutes. If ice in a Ziploc bag will work fine, you usually want to put a towel or a washcloth, something between the skin and the ice so the ice isn't too cold. Something to recommend, though, is a bag of frozen vegetables. They usually warm up about the 20 minutes, and so that's fine, and they're kind of already sealed and in little pieces that form around the injury pretty easily. So the acronyms to use when you're thinking about soft tissue injury are either ICES or RICE. So ice, putting ice on it, but remember no more than 30 minutes at a time. Compression, so wrapping it, not so tightly that you're cutting off circulation, but enough to put a little bit of pressure on there to minimize swelling. Elevation, elevate that injured extremity, and then support it, because we have a joint, likely a joint that's not as strong as it should be. We've stretched out some of those ligaments. The other way you can do it is rest, so don't use it. Put ice on it, compression, and elevation. Now, this is the way you should elevate a lower extremity. This is not. And if we just tell somebody to have their kid, elevate their leg, they're probably going to go home, sit on the couch, watch TV like this. We want the extremity above the heart. That's what elevation means, is elevated above the heart. Here it's not. You're not going to get as good of a reduction of edema with this as you are with this. and that's a good stopping spot.